Newsfeed Now. Coronavirus facts, not fear, begins now.
Good morning. Thanks so much for joining us for Newsfeed Now. I am Aaron Nolan. April the 10th is your day. It is a finally Friday. It is Good Friday as well. So a lot of things shaking, but it is 2020. And being that it is 2020, it's all things coronavirus. Let's jump into the latest COVID-19 numbers in the United States as we take a look at our national tracker map. More than 160,000 people infected in New York. You look down into Florida, 16,000. Illinois, 16,400. California, 20,000. A lot of different states, a lot of different numbers. New Jersey, they're kind of the second most infected state at 51,000. The Federal Reserve is continuing efforts to prop up the economy. The central bank, Matt, can you help me out? Thanks, buddy. The central bank announced a new $2.3 trillion round of loans that include even more support for small businesses and consumers. Also included for the first time, states, cities, and municipalities. Dozens of economists say there is no need to worry about an upcoming recession because we're already in one. They believe we will stay in one for the first half of the season, the first half of the year. It predicts a spike in unemployment. We've seen that. A decline in spending. We've seen that. A dip in the economic growth rate. We've seen that. But still, the economists are optimistic that things will bounce back in the second half of the year. Attorney General William Barr has ordered the Bureau of Prisons to prioritize the early release of some federal inmates in Louisiana, Connecticut, and Ohio. Dozens of inmates and staff have tested positive for the virus in facilities, and several inmates have died. Jesse Teneur has more.
Death is imminent for us.
We need help.
From desperate pleas for their lives in Alabama,
It's going to be a mass grave site,
to prison inmates demanding action in Washington state. Around the country, jails and prisons are spreading the coronavirus.
It's clearly a hot spot for the coronavirus and COVID-19.
One of the hardest hit federal prisons is in Louisiana Senator John Kennedy's home state. The federal correctional complex in Oakdale has reported 5 inmate deaths and more than 24 inmates and staff who have tested positive.
People in the community of Oakdale are scared. The prison guards are scared. The employees are scared. The prisoners are scared.
To combat the outbreaks in Louisiana and 2 other states, Attorney General William Barr recently ordered the Bureau of Prisons to prioritize the early release of certain federal inmates. But Kennedy doesn't think that's the right call.
Most of these prisoners are not there just for missing Sunday school. Many of them committed crimes of violence, and the answer is not just to let all our prisoners go.
BOP reports its prisons have moved nearly 600 inmates to home confinement. Kennedy worries those released could spread coronavirus in their community and wants to know how BOP plans to handle this.
If I don't hear something in short order, I'm going to raise fresh hell with them because the problem's not getting better.
Kennedy says he will continue to push for better quarantine measures inside prisons and better protection for staff. In Washington, I'm Jesse Teneur.
All right, Jesse joins us now live from Washington, D.C. Jesse, what an interesting tightrope that must be walked as we continue to try to combat coronavirus. But also, you know, like he said, they're in prison for a reason. When are the decisions going to be made, and kind of where do you draw the line in the prison system on who can get out early and who can't?
Yeah, you're right, Aaron. There is this really fine line that states are walking, and really the prison system in general is walking. And that number, even since yesterday, has changed. There's nearly 1,000 federal inmates that have now been released to home confinement, but these are nonviolent offenders. So it's not going to be sex offender cases even, no sex crimes, no violent offenses. It's mostly potentially misdemeanors and kind of what some lawmakers are referring to as blue-collar crimes, where you can essentially get an ankle monitor put on you and they can make sure that you're doing what you're supposed to be doing from home that way. But that's why lawmakers, like you heard from Louisiana Senator John Kennedy, are wanting to hear more from BOP about how they're notifying the community about this, how they're notifying local law enforcement about these inmates being put back into the community, because right now they're not exactly sure how that's being done in each state, even each city, each town, things of that nature.
Jesse, you talk about home confinement, you talk about ankle monitors. How are those patrolled, and will will you have to hire more people in order to look at these ankle monitors and if they're outside restricted areas?
Right, so that's a good point, and that falls to a local police or sheriff's department most of the time to do. Potentially, state police can help out with that as well. I think from what I've been hearing, it kind of depends on availability, but that's one of the things that lawmakers here want to know too, just because different states are different cities, counties are different. They want to know if there's kind of like this overarching protocol that everyone is receiving, these marching orders, or does it really depend on where you are in the country?
How can those of us in communities across America be sure that the home confinement are going to work? What are the parameters in place?
So really, they're just kind of hoping at this point that you just, trust the prison system and trust your law enforcement. And so they think that right now, BOP has been saying that they wouldn't be releasing them if they didn't think that it would essentially be helping the situation.
Gotcha.
And so they're just kind of asking for trust from the community in that regard. But then you also heard Kennedy mention something kind of interesting through all of this too. We're releasing inmates to stop the spread inside prisons, but then he's saying, what if for some reason, in their transportation to, home, or a family member or a friend at home that's still going out in the community, what if they for some reason, transfer coronavirus to them and then it continues to spread?
Yeah. It is a catch-22 in that situation, but we definitely do need to stop it in prison systems. And if people want to argue that, I don't think it's a smart argument there. It is something that is difficult. Jesse, thanks for taking the time. Very interesting stuff. And again, these issues are propping up that many of us, when the pandemic was first announced, we didn't think about. But now we're weeks in, looking at months in, and these things continue to pop up. The hotel industry is taking a massive hit. You might expect that. Data shows 20% of hotel rooms in the U.S. were occupied between March 29th and April 4th, 2 out of every 10 rooms. That's 68% less than this time last year. Analysts believe hotel occupancy may drop even more. It's tough to even think about booking a hotel, even thinking about going on vacation now. TikTok is lending a helping hand toward the fight. It's a social network. I'm not into TikTok yet, but I like this, donating $10 million to the World Health Organization and helping out those affected. One of Tennessee's hardest hit counties, 1/4 of the area's cases from a single nursing home. 2 frontline physicians are speaking out after they said they faced treating patients, nearly 100 patients, from the same nursing home in just a few days. Here's Erica Francis.
The weekend of March 27th, patients, close to 90 of them, brought to Sumner Regional Medical Center in waves, both by ambulance and bus.
It is what we prepare for and train for, but you're right. There is an unsettling factor when you're not sure how much and what exactly is going to roll through the door.
Sumner Regional Medical Center, Tennessee's first hospital to experience the consequences of unmitigated COVID-19 spread after more than 100 residents and staff members tested positive at the Gallatin Center for Rehabilitation and Healing. Dr. Zach Ramsey and Dr. Michelle Walther, both on the front line.
It was a pretty seamless operation, but nonetheless very scary for the patients, very scary for the staff and the hospital, knowing we are getting a large volume of patients in a very short amount of time.
We're ready to take care of those patients the best we could that night.
Describing that first night as a seamless but scary situation in a Zoom call Thursday, adding thankfully they had enough PPE.
It's a new illness and we're still figuring out best practices to take care of patients, but fortunately our hospital was very well prepared. We've been planning for this for weeks or months for a surge of patients. We weren't sure where or when it was going to come. Our ER group, our nurses, our staff have had excellent attitudes and have been fantastic at doing their jobs to take the best care of patients possible.
Dr. Ramsey learning lessons from U.S. epicenters like New York.
With excellent preparation, I think our hospital did a really good job managing it.
When asked if patients got to them too late, the two doctors said that wasn't their call.
Our job as emergency physicians is to take care of whoever is brought to us. We don't make the decision of who comes in, but we're always ready to take care of anyone in the emergency department.
Interesting stuff there out of Nashville, Tennessee. We had Erica on the phone. There she is. Erica joins us now live. Erica, obviously, situations like this are not what we want to hear, but what we do want to hear is the fact that our medical personnel were able to step up to the plate and really help out. Erica, are you muted by any chance? Will you check to see if you are on mute? You're not? All right, having some microphone issues there with Erica. Okay. All right, so Erica is not going to be able to join us today, but obviously as medical personnel continue to battle COVID-19 across our country, they're putting themselves in harm's way, and it's nice to see that in this case, as you heard from that doctor, that they did an excellent job managing what was given to them, and that's all you can ask for. That's all you can hope for. Erica, do you have audio? Erica, can you hear me?
Yeah, I can hear you.
Okay. All right. We've got Erica now. Erica, let's talk about, if we can, what happened in this situation. And obviously, in this situation, the medical center was pretty happy with how they were able to manage such a difficult situation.
Yeah, and that was great to hear from those two doctors yesterday. And to be honest, I don't think we were expecting them to say some of the things that they did, because seeing 90 plus patients with COVID-19 in a matter of just a few days, I mean, that's not what a ton of hospitals are prepared for. But they said that they were watching epicenters like New York City. So they've been preparing for the last 2 weeks, and they said they didn't know when the surge was going to be coming, but they were prepared for it. And as you saw with the story, they were. And I think the best part of all of this is that they said that they had enough PPE. So that was so great.
That is fantastic. And one thing that we have been told by medical experts, both on the national and the local level, were that nursing homes, rehabilitation centers were going to carry a lot of the brunt of this because of the severity of the conditions based around COVID-19. How are those patients doing right now, as you had close to 90 of them show up in just a few days?
You know, we're really trying to keep up with the numbers in regards to that certain nursing home. And I do have some unfortunate news. We just got word today that another patient has passed away. So that brings the total to 13 people at that nursing home that have now died. In regards to the rest of the numbers as to who remains in the hospital and who is resting at home, we don't have that information. You know, I mean, this is such a fluid situation. And getting some of those numbers has been a little bit difficult, I think, for all of the reporters out there.
Yeah, and that is something that we continue to juggle with. Before you go, I want to go over what Dr. Ramsey said. He described it seamless but scary. And I think that's exactly where we are in this country right now. You know, there's a lot of good things as far as communication that we've been able to see from this pandemic, but it doesn't make it any less scary.
No, not at all. And I think just going off of that, he said he wasn't scared because obviously that's what he's trained to do. He knows how to treat people. The scariest part about all of this, in his eyes, were that so many people are coming in and everybody has different symptoms. So he has to treat everybody differently, and that's where the tough part was.
Erica, thank you. Appreciate you taking the time. Let's end this finally Friday on a good note. People are rallying around healthcare workers. We're hearing that left and right. Erica was talking about that a moment ago. In Louisiana, a 12-year-old is hoping to make a difference. Here's Elise Corville.
Amid the spread of COVID-19, people are rallying around healthcare workers. 12-year-old Alicia Fruge's father has been a nurse at Opelousas General Health System for 20 years. After discovering a shortage of PPE, Alicia decided to help.
My dad had came home and he had stated that they were having to start reusing masks. So I had my sewing machine and I really didn't have anything to do, so I wanted to try and see if I could make them. Alicia, who received her first sewing machine 2 years ago, says it only takes her 5 minutes to make a mask. Cut out 3 rectangles of the fabric and then I sew the flannel piece to the regular piece, and then I take my elastics and I sew it to both sides, and then after that I flip this part and I sew it around. It would turn out like this.
She adds, even though her mask may not be perfect, she is proud to do her part to help the frontline heroes.
You want to make sure that you can protect them because they are trying to do their best, and then they're putting themselves at risk to help patients who are sick, knowing that they can get sick.
Awesome story. Fantastic. We love to see those giving back. We're all struggling. We're all stressed. We're all going through interesting, different times. We're going to make it out, folks. I promise you. It is Easter weekend. Try to find some way to enjoy the weekend, whether it's stormy, whether it's sunny. Enjoy your Easter weekend. We'll see you right back here on a Monday.
We are the strong ones, stronger together. This is a time for rising up. Being apart is bringing us closer. It's bringing out the best in us. We are the first line, out on the front lines, working together day and night. We're overcomers, keeping it going till we make it to the other side. And we're doing what we've gotta do, knowing love will pull us through. And we're stronger, stronger together. We rise up in our time of need. We are here.